Good morning, everyone, and welcome to another episode of our podcast, Insights from the Couch. Again, I am joined by Dr. Anamaria Ryan, my dear, dear friend, who is always on board to help me with these episodes, and I appreciate it so much. And she actually came up today with an awesome idea where we can talk about positive psychology. So, my name is Yalily Smith, owner of The Traveling Therapist, host of the podcast. And what is positive psychology? You know, taking away the stigma of the diagnosis, taking away the pressure of the diagnosis, and instead focusing on solutions, focusing on reading through the diagnosis, reading beyond the diagnosis into what can be done with the information that we're gathering and with the knowledge that we have now of the person itself and focusing on the person so that we can then find ways to help and improve the life of our patients. Um, Dr. Ana Maria, thank you so much for joining me. Um, let's jump right in. Tell me a little bit about why you felt like this would be a good topic.
Buenos dias, guten morning, bonjour, bon dia, all of those things. Good morning, everybody. The reason why I thought, and I hope you're doing okay, Jalili. Thank you
Thank you.
for inviting me.
Mhm.
The reason why I thought this would be a good topic to discuss is because we are still carrying the same stigma from 100 years ago or a little longer when we started classifying mental health diagnosis with the DSM, so on and so forth. And people were really afraid of having any of those things that are listed in the manual. And
Mhm.
so when you tell someone, not you, not me, but X person says, you know what, I'm thinking about seeing a therapist or seeing a psychologist. And the reaction is like, well, you're not crazy. I mean, you don't need that. Why would you do that? You can just go ahead and talk to your friends about this. So I think that we are still holding on to those diagnoses. Oftentimes I get people that have, let's say, generalized anxiety, which, by the way, is the illness of the century. Everyone is anxious.
True.
I don't care how zen you are, how much meditation you do. We live in a crazy world. We're bombarded with information. So at some point, you're going to have some sort of anxiety. And that person comes in feeling super awkward, super uh, ashamed that there is something with them. Like, how can I get this anxiety? What do I do? Do I take medication? Yes, in some cases it's necessary. But the reason why I wanted to discuss this is because I want to normalize what it is like to be human. And not everything that is in the DSM should be classified as a pathology. I do have some examples that we can talk about later, which I think are sort of funny. But that was the reason behind this, basically.
I actually I would agree with you 100%. I had a conversation not too long ago. I'm a preceptor, and if you guys don't know what a preceptor is basically like a babysitter for students of medicine and psychiatry and students of therapy. So master's level therapists, soon to be therapists and psychiatric nurse practitioners, et cetera, et cetera. And I was having a conversation with one of the schools that sends me students, and it happened to be the School of Nursing. And I was trying to get across to them how very difficult it is to have a student of psychiatric nurse practitioner in the office while I'm doing therapy. And the reason why is because while you have in medicine this culture of, oh, 50 people are going to walk through my door while I'm over here half dressed and, getting checked by a nurse, while at the same time, then you have the PA coming in, then you have the doctor coming in, you have the person that's going to schedule your x-ray, like you have dozens of people in and out of your room. It's, you're very comfortable with it. Everybody knows your diagnosis. Everybody talks to you about your health. Everybody plays a role. While that's the culture in medicine, in mental health, you walk in those doors, you don't want anybody to know you're there. You come in, you have the hat on, the glasses on, the mask on. You're like, I hope my friends don't see me in here. I hope I don't run into anybody. I hope nobody that knows me sees me here. And it's so different. And building rapport with the person takes months, and getting them to really open up to you about these things takes for like a lot of work. And it's very different from traditional medicine. And a lot of it comes from the shame mentality. A lot of it comes from fear, the stigma of like, what if they diagnose me with one of these horrible mental illnesses that I just can't get past? So I completely understand where you're coming from, because I've seen the parallels between the two in medicine, and I see it all the time. For us in mental health, we are, our profession is stigmatized significantly, and diagnosing does not help.
Yeah, I agree. Fun fact, the DSM, which is the diagnostic manual that we use in mental health to kind of like look at a situation and see where the person may be. One of the people who wrote the actual book presented a conference, and I was lucky enough to be in that conference. And he said the reason why the DSM exists is for professionals to communicate with one another. It's not for the client or the patient to take ownership of that diagnosis. And you see oftentimes people saying, I have my anxiety, my depression, my OCD. Girl, that ain't yours. Like it's just yes, it's just one condition that you may be going through. Just like you don't go around and say, "My name is Yalily and I am high blood pressure," or I don't say, "I'm Anamaria, I'm at diabetes." We don't go around saying that. So I think that people take this ownership for mental health issues that is unhealthy. Another fun fact is that the DSM has been revised a few times, and right now we are in revision number 5. And what that means is that the group of people who assess what is normal and what is abnormal, they tend to take things away and put things in. So, again, another fun fact, in the 1970s, being homosexual was considered a diagnosis. So, if you were homosexual, something was definitely wrong with you, and the treatment for this was, I'm going to beat the gay out of you, and that was called conversion therapy. Very mainstream back in the 70s and 60s. Beyond that, when some women at the beginning of the 20th century didn't want to comply with their husbands, they would be sent to a home. I'm going to call it cuckoo home, excuse me for the term, but that's what it was. And they would be repeatedly raped with objects until they were more pliable, and they were more conforming to the rules of the husband, and that was being hysterical. Hysterical is just an illness for women because hyster means womb, right? So if you were hysterical, it's because you were a crazy woman that was not doing what your husband was telling you to do. Another example that is more recent is Asperger's, which once upon a time when I trained used to be a diagnosis, and now it's no longer. It is part of the spectrum of autism, and the correct word to use would be neurodiversion. So little things like that. For example, psychopath and sociopath are no longer words that are used. We're talking about antisocial personality disorder instead. If you like to drink coffee, my friend Jalili, like I do, I'm Colombian. I drink coffee all day long. Coffee is my thing. Well, I may be addicted to caffeine according to the DSM. So those are the things that sometimes we need to look into and just have kind of like a critical mind and go like, wait a minute, is this really a clinical problem? Is this a hindrance to my life? Are the professionals utilizing this information to communicate with one another? Or am I taking ownership for this so that I am cozy and comfy in my comfort zone? A lot of people go like, "Wow, I got this social anxiety." Yes, I know you do, but you have to function in the world, and you cannot be just sitting there waiting for this social anxiety to go away, so that you can function. So little things like that. And fortunately for the 21st century, we have positive psychology, which is, I think, based more in solution focused approaches to therapy, right? So instead of having the patient laying down in the couch, which is that image until this day, you go anywhere, go and look for stock images somewhere, and there is somebody laying in a couch. I don't know about you, girl, in your office, but I don't have anybody laying on the couch. I don't do psychoanalysis. This is very old school. So instead of thinking that the patient is going to sit with you for the rest of their lives trying to figure something out while you're in silence, we try to be a little more active and we try to offer solutions. And that's where positive psychology kicks in. There are some parts of positive psychology that we can discuss if you want to. But I do want to hear kind of like your experience with trying to normalize certain things. Or I know we have to point stuff out, right? Like if a person has borderline personality disorder, I'm sure you have to explain this to a person and say, well, look, there is this, maybe you have some symptoms of this. What do you think? How can we help you? But I would love to pick your brain regarding positive psychology and how you have applied that in your practice, instead of just playing the little violin for the client that is suffering with their symptoms.
I think positive psychology is often misconstrued, almost like how, um, what is it? Parenting, soft parenting, or what do you call it? That parenting style. What is it?
Yes, I know what you're talking about, but it escapes
It's
my
not
mind right now.
soft, but it's like that. I don't know, where basically they think that you just give in to everything that the kid does. I think when you put the word positive in front of it, people think that it's automatically, oh, well, your feelings are all that matter. And it's, let me go ahead and just stroke your ego and like try to kiss your problems goodbye for you and like make everything go away and make everything okay for you. My point of view of positive psychology is very different. I believe that there should be, that if nobody else can be honest with you, at least your therapist should be. I think that it should be about talking through, here's the diagnosis. If we do discuss the diagnosis, like, here's the diagnosis. This is what the diagnosis actually means, not what you've heard on the street, not what you've heard on social media. This is not what you've seen on TV. Like, this is what the diagnosis actually means. These are the ways in which we can work through the different symptoms of the diagnosis, because just because you have that diagnosis doesn't mean that you experience all of the symptoms. So just discussing honestly and clearly uh the degrees of severity of the diagnosis, where you land on the diagnosis, how it works for you, how it doesn't work for you, what your questions are, what your concerns are, and then being realistic about what you can and cannot do. Um, for example, I've had many conversations with our therapists about how we treat individuals with bipolar disorder. And to me, positive psychology is being able to go to someone who has bipolar disorder, introducing them to the diagnosis, educating them about the diagnosis, creating a safety plan around it, but then also understanding that this is something you're going to have to live with for the rest of your life. So, how do you embrace who you are despite the diagnosis? So, we talk about, instead of, oh, well, maybe you need to meditate every day. No, a person with bipolar disorder should be going and bungee jumping, or they should be going to the gym, or they should be going to a dance class, or they should be doing things that are highly motivating, that should be a lot of fun, that should be almost just at the border of risk taking. because that's the personality, a little bit chaotic, a little bit out there, super artistic. And so, like, embracing that rather than saying, "Oh, man, you have bipolar disorder, your life is over." Everything is done. So that's positive psychology in my mind.
I was thinking that one of the questions that I often ask my clients is how this situation is a hindrance in your life, or how it's impacting your quality of life. And if it happens to be something that you can manage already, that you have coping skills that are positive, then why not? The other part to it is that yes, you can be all the positive you want to, and have positivity and manifest and all that stuff, but some things are not going to go away. If you have depression, you have depression, and your body is not going to be making serotonin, so you may need to actually take a little something to help you out with this. So in terms of positive psychology, what I wanted to highlight is that we are not focusing on a model that is disease based, kind of
Mhm.
like, this is what you got, this is it, there's no way out, you're gonna have to, yes, I mean, clearly you may have to live the rest of your life with this, but instead of that, maybe accepting emotions as they are. I don't believe that emotions are positive or negative. You can probably correct me if you're in disagreement, but I feel like emotions are just emotions. They are an experience of being human and being an animal. And I feel with positive psychology, enhancing those moments when you feel good is extremely important. There's actually an acronym that is called PERMA, PERMA. And the first word stands for enhancing those emotions that are good to you. What you were saying, say that you're manic. Okay, so instead of going to the casino and gambling your paycheck, maybe you can look for, I don't know, create a business, right? That's a good way to enhance an emotion or a feeling that is, I'm going to call it positive. You have to engage. You definitely have to be part of a group of people or someone that understands what you're going through. Even if this is something like an adjustment disorder. So like a normal problem of life, that is also very important to do. Relationships, you and I have talked about this in other podcasts. I feel like being connected is super important. And it's important to, Jalili, I feel, to have meaning.
Mhm.
Why is this happening for me? Why have I been gifted with depression? And I can talk about that because I do have depression. And why have I been gifted with this? I look at it that way, right? Like, what is the reason? What have I learned through my journey with depression? I've learned to be more compassionate with my clients that go through this. I've learned that this feels really awful when you feel it, so it's a good way to explore the sense of purpose when you have something going on. And then lastly, accomplishment, which means if you do something small, even if you feel like crap, I don't care what diagnosis you have, something small will make you feel better. Especially with my folks that have attention deficit.
Ah,
I
yeah.
know they have like this monumental ball of things that they want to tackle, and then they don't do anything. So even if it is just getting up in the morning and washing your coffee pot, that's it. That's an accomplishment. That's something that you kind of like focus on. So those are the elements that I would say that I like to focus on with positive psychology, and enhancing the person's characteristics that are
Yeah.
wonderful. I think you and I had discussed Myers Briggs in our relationship as friends.
Yeah.
And I love Myers Briggs because it talks about your personality the way you are. I have bad news for all of you introverts out there like myself. We are not going to change. Being an introvert is something that you're born with. Yes, you can learn how to extrovert. Yes, you can learn how to socialize and all that jazz. But, girl, at some point you're going to be tired and you want to go home and maybe read a book or watch a movie, and that's okay. So I think positive psychology in a nutshell is just enhancing what you already have to work with. And if you have something here, like maybe anxiety, OCD, depression, whatever that is, you learn how to incorporate that, not as part of you, but as part of your life. It's kind of like what I was thinking.
Yeah, I think that another aspect of positive psychology too is to understand that that diagnosis does not make or break you. I think it's very important to understand that our diagnosis is only a piece of the whole person.
Yes.
Just like, so you are a person who suffers from depression, for example, that does not mean that that is all of who you are and it permeates all of who you are. Like, you are also intelligent and you are also kind and you're also hardworking and you're also a good parent and you're also a good, a good sister and uh all these different things. It's a million little tiny pieces that put together the puzzle that is your personality. And sometimes I would say with positive psychology, one of the things that I enjoy teaching people is about looking at themselves as more of the whole picture of who they are rather than, oh, well, I guess I'm just stuck being this way for the rest of my life because this is the label that, the scientific community or the therapeutic community has given me. And so I cannot get away from it. It's like, try to look at yourself far beyond the labels of society and try to think more about who you are internally and who you are as a being, as a whole being. Um, because it's so much more than just, oh, you check the boxes of three, four different symptoms and now this is it.
That's right. And the thing about taking ownership for those symptoms or that diagnosis is that it doesn't allow you to grow OC further. I have had numerous people that I go like, well, why did we try this? Oh no, that's not gonna work for me. Okay. Well, I mean, have you considered maybe ketamine treatment? No, that doesn't work for me. So it really closes you into this world of I am ill, I am sick, something's wrong with me. And that cannot be further from the truth. Even people who have active psychosis have moments in which they can have some sort of quality of life if they're medicated, of course. But I was thinking, this is a quick story, if I if I may. In this organization, I used to work, and nothing against your ethnicity, my love, because I love you, you know that. But there was this Cubanazo, this older Cuban gentleman. I'm gonna say,
I won't take that as an offense because I know your weakness for Cuban men. So
oh, that I love them. You know how much I do. But so think there you go. Thank you. So, but it's nothing against it. It's the part that I was going with this, Yalily, is that the gentleman was probably in his mid 60s, and he was one of those that he wouldn't go to the doctor for no reason. Like no, I don't ever, I don't know if the man ever saw a doctor in his life, but he was not going. So he was hallucinating, and the family are like, we got to take him somewhere. And fortunately, at the time, I used to work with a psychiatrist across the street from my building. So I would do psychotherapy, and the psychiatrist would do the medical treatment.
mm.
And the gentleman didn't speak English. So I was one of the at the time I was one of the only clinicians that spoke Spanish. So I started talking to him. I'm like, what's going on? Like what's happening? What are you seeing? Blah, blah. And he was talking about some things. And I'm like, this man is delusional. Of course, he's got some sort of delirium. So I explained this to the nurse, and I said to the nurse, "Do you think something may be going on here? Because this is weird. Like he's got a clean bill of health. Like this is random, and that doesn't. I mean, at 60 something, that's kind of odd." Thankfully, they did some blood work, and it happened to be that he had sugar problems, and his sugar
Oh,
was off. Uh, it was
he was
wacky.
sick.
So, but the gentleman didn't know. So, thankfully, they didn't shoot him with the Haldol because they did something else, whatever. Haldol is an antipsychotic, but little things like that, we just got to be super mindful of and not be afraid of mental health because guess what? Sometimes it's not even mental health. It could
Mhm.
be your thyroid, it could be your liver, it could be a number of things.
I love whenever I work with my patients, going through and discussing, Are you taking supplements? Are you exercising regularly? However the heck it is, I don't care. You go for a walk, you just because you have to take the dog out, okay, that's a form of exercise. You go to the gym, you go to a Zumba class, I don't care. But are you getting out? Is your heart rate going up every once in a while for anything other than anxiety? Um, like, how are you eating? Are you drinking enough water? I like to evaluate the person as thoroughly as I possibly can because I agree with you. There are so many aspects of the person, and that's why I love, mind, body, and spirit because
Well,
it
that's
it
absolutely.
always goes back to the person. It always goes back to the person. And we talk about, for example, we talk about trauma, and I love there's a neurologist that I love following his work because he has done brain scans for thousands of people. Just watching how the brain is affected because he's a neurologist, but his expertise is in psychology, and he has looked at thousands of brains before trauma, after trauma, whether it's blunt trauma, whether it's childhood trauma, whether it's, all these different things,
Mhm.
illnesses that have happened. And it is amazing how our mind develops around the trauma. And then
Correct.
right, and then you think about, oh, well, this is a problem that I have right now, and I have to fix it right now. And it's like, we have to look at the whole picture. And you're going to say something, I thought.
No, I didn't mean to interrupt you, but I was just also thinking about how some diagnoses overlap. You can have someone who has attention deficit, but then there is anxiety here. So, what is it, the chicken or the egg? Do you have someone that has PTSD but is presenting with a other thing? So, I guess my point here too is that we need to take the psychological diagnosis, we need to take that easy. And with all the information that is out there, you probably get your clients telling you, I Googled this or I read this and it said that I had this and that and the other. So let's just use a little more critical thinking when it comes to that stuff. And I just wanted to say one more thing because you remind me of this too. Um, Once again, agency times, long time ago, right? Ancient history. This woman, I think she probably might have been from El Salvador. I can't remember, somewhere around there. Very spiritual person, and she was explaining to me how this person had said some sort of spell, mal de ojo.
Mm.
I don't know for the people that don't speak Spanish if you know what that means, but it is kind of like a traditional, maybe spiritual,
July.
witchcrafty kind of a thing that other people don't understand. Anglo-Saxon cultures are not really into that stuff. So the person that was evaluating her was saying this woman is absolutely, she's schizophrenic. She's making stuff up. If you go in the back of the DSM, there are exclusions to those diagnoses. And as if I'm not remember, if I think I remember correctly, Maldeo is one of those things because it's a spiritual situation. So you cannot assume that because someone is having that experience that that person is sick with something. When
Mhm.
people grieve, Jalili, I don't know if you have seen this happening, but sometimes I hear my clients telling me, I saw my loved one or I heard my loved one. That don't mean you're crazy. What that mean, I hate to use that word, but what that means is that you're going through your grieving process. So it's just something that I wanted to throw out there too.
Absolutely. The spiritual aspect of who we are as a person plays a huge part. I I've had patients that have talked to me about their experience going and talking to their pastors and their bishops and things like that, discussing about dreams that they've had or eh, encounters that they've had with spirits or with, entities and things like that. And these pastors talk to them one on one as a regular person having a true encounter. They don't typically go, I mean, if it's a halfway decent one, they don't typically go and say, "Oh, well, you're crazy. So call here's the phone number for your near psychiatrist." No, they'll talk to the person as if it is what it is. Okay, thank you for sharing this. Let's pray, or let's discuss it further, or let's do something. Like, there's a million different things that that they, do, whether laying off of hands, whether it's a ritual of some sort, or
Prayer.
whatever. But the point ends up being that sometimes we think that we're the problem, and and that we're wrong, and there's something wrong, and now we get this boom label that's just
Exactly. Mhm.
it guarantees that we're right. It's true. There is something wrong with me. I am broken. I am dysfunctional. And the fact of the matter is, every single aspect of what you experience as a person has multiple facets to it. There's culture, there's society, there's religion, there's trauma, there's family, I mean,
Family.
it's just boundless amounts of layers. You're so much more than just this 2D image of a human. You are a very deep and profound being, and everything that happens to you has a bearing in the way that you experience the world. And having a diagnosis, whatever the diagnosis is, it's just one very, very small layer of the greater picture. And so, back to into I you know discussing the final thoughts on the topic, back to the positive psychology. Look at yourself again and critically assess, is this who I am, and what does it mean to be this way? How do I incorporate this into my person? How do I not let it take ownership of who I am? How can I still see myself as a full being, full of potential, full of capacity for growth and for learning and for self-love and loving others and empathy and kindness? How do I look beyond the things that make me feel uncomfortable about myself?
And if I may piggyback, this is the last thing that I would say. I know that I use the word crazy, but the word crazy actually means doing the same thing over and over again, expecting different results. If you happen to have a mental health diagnosis, you're not broken, you're not defective, nothing's wrong with you. You're just a human being, like all of us having a human experience. And let's try to get you to have the best quality of life possible, which is the job that we do as therapists. So thank you for giving me the opportunity to talk about this, because I thought it was really important for some people to feel that way, like they're not broken or damaged or crazy.
I think so. I agree 100%. Thank you so much, Dr. Ana Maria, for suggesting the topic and for joining me. And I hope that you guys take this to heart. And the next time you look at yourself in the mirror and you consider what you've been labeled, whatever any of those labels may be, whether it's by your therapist or your doctor, your mother, your father, your sister, your brother, your pastor, your spiritual guide, your coach, whoever, look at what I we hope that when you look at yourself in the mirror and you consider these labels, that you remember that you're something beyond all of those things, that you're so much more than that, and that you're very, very loved, and you're very special, and that you have tremendous potential. And there's nothing in this world, no label whatsoever, no person that can truly define you for who you really are, only yourself. So thank you for joining us. And we hope you have a wonderful rest of your week. And we'll see each other again in the next episode of Insights from the Couch.
See you next time.
Bye.